It's time for The Well with Lexington Health. Today we are joined by neurosurgeon Dr. Justin Gibson. How are you doing today?
I'm doing well. How are you, Destiny?
I'm doing good. Thank you for being here.
My pleasure.
So, Dr. Gibson, to start off, why are our backs and spines so vulnerable when we suddenly jump into spring yard work or other activities?
Certainly. So the old adage, if you don't use it, you lose it, is true. So after a season of holidays and everything like that, where you're relaxing and not doing a whole lot with your back, to jump into activities, especially like in the garden or outdoors where there's a lot of bending and twisting, that's kind of a shock to the system if it hasn't been used for a while. And so I recommend easing into that rather than jumping into that.
I love that. And then knowing how vulnerable those discs are and joints, what is the top advice for protecting your spine while we get into that yard work?
Definitely starting slow rather than jumping into like an 8-hour day in the yard, number one, is a good idea. Simple things like stretching and kind of getting ready for a big activity day will prevent injuries to the musculoskeletal system. And then in addition, anything you can do leading up to it to kind of prime yourself, whether that's in the gym or walking, running, things to prime your back a little bit to make sure it's ready for those activities will help you out.
And a little muscle soreness on a day or two after intense work can be normal, but with your expertise, what are the red flags that someone has to pay attention to know that it's real damage or they need to see a specialist?
Certainly. So sore back is normal, right? So if you have a day or two of soreness after working out or doing gardening, yard work, totally normal. Now, if you have pain radiating down the leg, what people will call sciatica pain, or back pain that's severe that doesn't stop after a few days, certainly that'd be a reason to seek additional investigation by either us or your primary care physician as the first step. And then the red flags, which are very, very rare, but if you ever have any issues with your bowel or bladder function or numbness in that region, that would be a reason to go to urgent care of the emergency department, but that's exceedingly rare.
Thank you so much, Dr. Gibson. We appreciate your expertise.
My pleasure. Happy to be here.
Of course. And for those out there interested in learning more about Lexington Health, you can scan that QR code on your screen right now.